Good afternoon. Thank you everyone for joining us here today. My name is Jonathan Wittenberg. I'm the acting CEO here at the Guttmacher Institute. I'm really excited to see so many friends of Guttmacher and partners in the field on this virtual event today. And I know that speaks both to the urgency of this moment and to the truly excellent panelists that we've assembled today to mark what used to be a celebratory occasion, the anniversary of Roe v. Wade, and now serves as a reminder that progress is not inevitable. It requires sustained commitment, innovation, funding, collaboration, and so much more. Our panelists today are going to share their wisdom with us about how we create a future that's not just about restoring Roe v. Wade, which we know was never enough, but advancing a forward-looking vision for sexual and reproductive health, rights, and justice worldwide. Before I introduce our esteemed moderator and panelists, some quick housekeeping. Please note this event is being recorded for later viewing. You can use the Q&A function in Zoom to queue up questions for the panelists at any time. And note that we'll do our best to get to some of them later in the program. Okay, on to our panelists. We have a really dynamic panel and moderator today to share how the landscape of abortion rights and threats to democracy are intertwined. First, you'll hear from my colleague Kelly Baden, who joined us last year as Guttmacher's Vice President for Public Policy, bringing her deep experience building new programs, including the country's only national cohort of state legislators committed to abortion rights. Kelly and her amazing policy team work to ensure that Guttmacher's research and data informs policy change everywhere. Our next panelist is going to be Khadine Bennett, the Director of Advocacy and Intergovernmental Affairs for the ACLU of Illinois. You might know Illinois as a stronghold for abortion rights and access in the Midwest and beyond, and Khadine's work is one of the key reasons why Illinois is the beacon that it is. She works daily with legislators and advocates to keep securing Illinois' ability to expand access to abortion care, and she's a noted expert on proactive state policies. We're also excited to have Kimberly Inez McGuire, Executive Director of URGE, United for Reproductive and Gender Equity. If someone is talking about young people and reproductive justice and how we can organize and win in states that others have said we can't win in, Kimberly is there. Our moderator needs little introduction, but deserves a big one. You might know her as one of the most successful and visible feminists of her generation, which is how the Washington Post described her. You may know her from one of her 7 books, including The Purity Myth and Full Frontal Feminism, or you may have been a reader of her groundbreaking and game-changing blog launched in 2004, feministing.com. And I hope you know her now as the founder of Abortion Every Day, which is a comprehensive daily newsletter dedicated to abortion rights that is essential reading for so many of us here at Guttmacher, myself included, and where she's written extensively on the intersection of attacks on abortion and attacks on democracy. Jessica, thank you so much for being with us here today, and I'll turn it over to you.
Hi. Thank you so much, Jonathan, for such a nice introduction, and hello to everyone. Um, Thank you so much to the Guttmacher Institute for hosting this event, and really for being such an incredible source of critical data, critical research. I can tell you that I rely on Guttmacher constantly for my own work, and really everything that you're doing is completely invaluable, I know, to a lot of people who are here today, so thank you. I'm also really excited to be in a space with so many people who really do understand the urgency around this issue and who are working in so many different ways to confront the attacks on our bodies and freedom and democracy. And I'm especially excited to be in conversation with such an incredible group of panelists. And before we talk to them, I'm just going to tell you a little bit about my work. As Jonathan said, I publish a newsletter called Abortion Every Day. For those of you who may be unfamiliar, Abortion Every Day is a daily newsletter where I'm really tracking anything and everything that's happening with abortion rights, from legal challenges and bans to conservative strategy and the horror stories coming out of anti-choice states, unfortunately. I think when I started it at first, I was a little bit naive and sort of wondered if I would have enough to write about every day. Now my joke is that I probably should have called it Abortion Every Hour, because that is how often news is coming out. That is how often we're being attacked. And if you're on this Zoom right now, you all know that better than anyone, the way that we're being attacked on all fronts, the way that we're being inundated. And of course, that is very much the point. The anti-abortion movement, Republicans, want to overwhelm us into inaction. They want us to be so confused and so bombarded that we don't know where to start or what to prioritize. They want us to be so busy working to reduce the suffering that their laws have caused that we won't notice the new spate of attacks that they're launching every single day. And so my hope with the newsletter is that Abortion Every Day will provide a little bit of order to that chaos and offer some necessary through lines. The goal is really to arm people with the information that they need to fight back, whether that's folks like you who maybe do this work all the time, or just someone who wants to be able to hold their own in a debate with their uncle. A question I get asked a lot about the newsletter is, don't you feel like you're preaching to the choir? And what I like to say is, I don't feel like I'm preaching to the choir. I feel like I'm arming the choir with what they need to go out and fight another day. Unfortunately, there is a lot to cover. In addition to the bans and the court battles, what we've ended up covering, I think, the most at Abortion Every Day is just the absolute cruelty and the extremism of the anti-abortion movement and just how little they care about the suffering that their laws have caused and are causing. Recently, I've written about a campaign that some of the biggest anti-choice groups in the country are rolling out to ensure that people are pressured or forced to carry doomed pregnancies to term. And just last week, I wrote about legislation that forces doctors to give people with life-threatening pregnancies C-sections or have them deliver vaginally instead of giving them emergency abortions. And that's really just scratching the surface of the post-Roe reality that we're all in. And it's really challenging and it's really difficult and it's really, really dark. But that is part of the reason I'm really glad to be having this conversation, because I do feel like there are so many bright spots, and the work that the panelists here are doing really is some of them. So I just wanted to start with Kimberly by asking you about the one area that I know a lot of us feel pretty optimistic about, and that is the way that abortion has won in every ballot measure since the Dobbs decision. I think we're at 7 and counting. You did some work in Ohio, which of course was this really amazing victory. Can you talk a little bit about what happened in the state, what some of the winning tactics were, some of the winning strategies and messages, and what does that tell us about where we should be focusing our attention and resources?
Absolutely. Really excited to be here. Excited for this conversation with you, Jessica, and so much appreciation to the Guttmacher crew for inviting me. It's true. We are 7 for 7 for abortion on the ballot in the post-Dobbs America. It's huge. It's exciting. But I want to be really clear that every single one of those fights was incredibly difficult, incredibly expensive, and took so much work, including by Black women, young people, and trans folks who don't often get credit for what they did to secure those victories. So I want us to be proud. I want us to be excited, but we cannot take for granted that we win every time because of the work involved. I'm really proud that URGE has played a role in the victories in both Kansas and Ohio, and want to give so much love and appreciation to the URGE team and to the URGE chapters on the ground that galvanize young people across their states, in places like Kansas and Ohio that many folks have given up on and think of as, not worth fighting for. We know that's not true. We know the South is worth fighting for, the Midwest is worth fighting for, and heck, we've even been able to win. So how did we win in Ohio? I want to share a little bit about kind of what we learned and what I think it means for this year when, the list of states going to the ballot is long. So first and foremost, the connection between abortion and democracy cannot be underestimated. And actually in Ohio, the other side really tipped their hand because they saw us going to the ballot to protect abortion. And what did they do? In the August ballot before the November election, they tried to basically make ballot initiatives impossible to win. They actually, in order to try to beat us on abortion, their solution was to dismantle democracy. So even as we think of these issues as being related in terms of our lives, the self-determination of pregnancy, the self-determination of our communities, those who want us to lose are dismantling our rights in both arenas, and they see this as a common fight as well. some of what we did in Ohio that I'm really proud of. So from the beginning, BIPOC and reproductive justice leadership in the campaign was essential. I want to give a huge shout out to Sarita Fontanesi, who was just one of the incredible leaders at URGE who helped with this effort in Ohio. I also want to lift up our colleagues at Ohio Women's Alliance and New Voices for Reproductive Justice. Ohio had 3 BIPOC-led and serving organizations at the leadership level on a ballot initiative. That almost never happens. It needs to happen more. We had a comprehensive plan for the entire state. We took no voters for granted. That included having a comprehensive and specific plan for how we would engage with Black voters in Ohio from the beginning. Too often, communities of color are an afterthought in these kinds of campaigns. We cannot win unless we are engaging every voter and every community. We also won because we had broad-based organizing. We need more than just the abortion advocates to fight for abortion. So we had racial justice, immigrant justice, labor, queer and trans folks all across the state in every single county fighting for this effort. More than 1 million Ohioans took action before we even went to vote. That means they either signed a petition, they made a donation, they collected signatures. This was truly a broad effort. So what does this mean? We can keep winning at the ballot, but it takes a lot of work and thoughtful strategy. It's not an assumption that we absolutely can. I also want to name the opposition is getting smarter. They know that the people are with us. They know how unpopular abortion bans are. And so in Ohio, they actually leverage the full force and power of the state government against us. They were canceling out signatures for no reason. There were literally like offices we had to work with that closed at like 3:45 p.m. on a Tuesday. It was impossible to get in. We had disputes about the color of the ink on a signature. There was a voter purge. I mean, everything they could throw at us to try to defeat us. And we had to come back and beat them every time. So what it means is if you need 500,000 signatures, you better get 1 million, because the state is going to find a way to actually make your campaign harder to win. Some other lessons I want to share. Ballot initiatives do a specific thing. They allow us to tap into where voters are and what voters care about to address an issue that maybe can't be addressed through a legislature because of gerrymandering, because of all of the issues with democracy that we have in a lot of the places where URGE works in the South and the Midwest. But ballot initiatives can't do everything. They can't change public opinion. They can't in and of themselves build movement, and they're a short-term strategy. So while they're an important tool in the toolbox, I want to be clear, they're not the only tool or the only way to win. And it is only through long-term sustained organizing that starts before the ballot initiative and continues beyond, and that includes and centers the leadership of young people and people of color, that we can win in a long term. The last thing I want to say is also to name, again, ballot initiatives can do a lot. I'm really proud that abortion is legal in Kansas and Ohio, thanks in part to the work of URGE. And we have more to do, because we have to name as well that even after this huge victory in Ohio, we saw very shortly after the criminalization of pregnancy, in particular, the criminalization of Brittany Watts, who was criminalized for miscarriage. While the grand jury decided not to indict, the fact that we are seeing once again, in particular, Black, immigrant, young, and trans people being criminalized for pregnancy, even where we win on abortion, it means we have more work to do. I'll turn it back to you, Jessica.
Thank you so much for that. I could listen to you talk about Ohio and your work all day long, to be honest. So brilliant. And I think it's such a testament. I'm so glad that you talked about the attacks on democracy and all of the hurdles that Republicans threw at you all, because I think it's such a testament to the incredible activism that you and everyone else on the ground did. That not only were you able to win, it wasn't like you won by 50% plus one. Like you really won, and I think it's just, again, such an incredible testament to the work that you did. So thank you, Khadine. You are in a state, you're in Illinois, that has been able to enact protections for abortion rights. And I know Kelly is going to talk a little bit about how Guttmacher's monthly abortion provision study showed that Illinois really has served as a key access point for abortion patients, both in the region and probably the whole country. Could you talk a little bit, could you share some examples of how Illinois prepared for Dobbs And how have you all responded since then? And what are some of the strategies that you used to make all of this success happen?
Yeah, thank you so much. And again, thanks to Guttmacher for bringing us here together. And I would first start by saying all of the work and the work I'm talking about is based on a collective effort. So we win when we're moving together in the same direction, using our different tools in order to get the best strategic outcome possible. And it took a lot of work. I mean, Illinois is seen as a go-to state for people seeking care, but that work didn't happen overnight. It happened over many, many years of building. And then starting in 2017, we saw some of those wins. So in 2017, we had the ability to allow for Medicaid coverage of abortion. We removed the trigger law provision in our abortion law that would have criminalized abortion if the Supreme Court overturned Roe. During that time, especially when we were talking about the trigger law provision, lots of people were asking, do we really need this? Is Roe ever going to fall? Maybe you all are overreacting, but we were able to get the votes to get that done. While that was happening, we were also working on having a establishing a fundamental right to make individual decisions about reproductive health care, including contraception, abortion care, and maternity care. And in 2019, we worked to pass the Reproductive Health and Access Act. That was another place where it took a long time. We were working on it even before House Bill 40 passed in 2017, and it took an extra 2 years after that to get to that win, in part because we had folks who were saying, well, we just did this one thing. Do we need to do something more? Why can't we, take a break for a little bit? And we pushed on, our coalition pushed on, our legislative champions pushed on. There was a lot of education that was done there. I think a tipping point in that time was in that moment, there were states that were passing really bad laws, and we were stuck in terms of whether or not we can get this over the finish line. And one of the things that really made an impact after those states started passing those laws is a bunch of legislators who were in states where they couldn't do affirmative protections. Thanks to Kelly in her old job, reached out to her and asked, is it possible for them to talk to our legislators? And they not only did a video, but they also came to talk to our General Assembly to say, you were in a place where you were able to have protections that our folks don't have access to, and they may not have access to in the worst case scenario of Roe falling. Can you take this action? And after a period of time, they did. And it's interesting now when I think about it, the thing that those legislators were hoping that we would do, which would be a safe haven, is the thing that we are now. That also required, again, a lot of folks showing up, taking action, pushing their legislators. And then we got to, in 2021, the repeal of our Parental Notice of Abortion Act that required minors to notify adult family members before they can have an abortion. And that was one of the more difficult bills, because I think when you think about, from some people's perspective, access to abortion in minors, sometimes people get a little squishy about it. But I have to give props to our legislators and our coalition partners really mobilizing. And some of that work was led by young people who were able to talk about why this issue was important to them. And we were at the end of 2021 in a good place. I would say that while we had these victories, they weren't easy wins. They weren't slam dunks, and we didn't have lots of extra votes as we were getting those roll calls together. I think it's really important to have coalition networks of people who can really not just push the legislators, our legislators, elected officials to take action, but also to support them after they do take that action, and also to let them know that your job is never done. So fast forward to the post-leak and pre-Dobbs decision, one of the first things that we did was to remind people of the protections we had in Illinois. So many people were so freaked out about what can happen, what would happen to choice. Even folks who worked with us in Illinois to get some of these protections in place, there was a lot of misinformation out there. And a really key important thing was to remind people that in Illinois, we have created this foundation of protection, and this is the time to utilize it. We spent a lot of time infiltrating info gathering. So while we may have had policy priorities in mind, we really wanted to hear from the folks who were on the ground about what they needed, they wanted, what they were seeing. So we spent a lot of time talking to abortion providers, folks who provide direct support for people who are seeking abortions, folks who do trainings for providers of abortions. We tapped into our existing coalitions, our networks, and partners to hear about what their not just their needs were in the short term, what were their concerns and their fears, what were their long and short-term priorities. We also leveraged our relationships that are outside of Illinois. ACLU of Illinois is part of a national network of affiliates and a national office. And we also have relationships with national and local organizations in other states, especially states that we were expecting folks to come to Illinois to access care. So again, talking to folks on the ground in those states to figure out how we can continue to be a resource for them and support what they were seeing to find the best policy solution. We did a lot of briefings and conversations, not just with policymakers, but also coalition members, organizational partners, funders, our members, our supporters, to let people know that while we may have strong protections in Illinois, we needed to do more, and it was an all hands on deck approach to it. We were lucky that we had a strong pro-choice leadership with our governor's office, our attorney general's office, our House and Senate leadership. And then we had strong partners in the General Assembly who we knew had our back in terms of continuing to think about and pass the right policy to support not just folks in Illinois who are providing care, but folks who are coming to Illinois to seek care. And also keeping in mind there are folks in Illinois who we may have great laws in place, but may not have always been able to access the laws that we had here. It was also so we were able to move our PAPA bill, as we call it, that increased access, address concerns around providing protections for providers, especially providers who were licensed in other states or who were coming to Illinois to provide care as well. In terms of some of the lessons learned and strategies, I think conversations and not assuming, but having holistic conversations to figure out what the need is and continuing these conversations was really, really important. Working in coalition where understanding that there are different people who bring different tools, skills, relationships, and all of those things are valid as we try to advance protection, as we try to address the needs, not just laws on the books, but making sure it's meaningful and accessible to the folks who need and want it. I think having partners in the administration and other agencies is critical as well. And then coalition partners and supporters and people who care about the issues of reproductive health and access, not just caring about it theoretically, but taking action. Even though people consider us a protective state, which we are, the opponents to access to care, both reproductive care and gender affirming care, they're very mobilized, they're very loud. So it's really critical for us to have as many people as they have. We need to have those people as well. And sometimes that can be hard because people are tired, they, need a breath, but that kind of persistence is really, really critical. The other thing is, I think one of the things we saw is just the connection to abortion care, abortion rights, and gender affirming care. We have providers who provide both care for both issues. Sometimes people are able to get to reproductive care, abortion care, understand why that right is needed and it should be defended. But that's also critical for gender affirming care as well. And we can't leave them, we separate those two. The other thing is having a combination of stories, experiences plus data has been really, really helpful. So we have the stories when we were passing affirmative bills. It was great to hear from people who were directly impacted to talk about why these policy changes were needed. It was really important to hear from providers who talked about why it's important to have full clear abortion access in place. It was really important to hear the stories that folks were seeing after the Dobbs decision happened, the fear, the chaos that ensued. And those stories were critical, but it was also important to have the data. And that's one of the places where I think that Guttmacher has been really, really an excellent partner and an excellent resource, because we knew that more people were going to come to Illinois, but we now have the data to show. And I think that they've been responsive to the kind of data that is critical in order for us to think about policy changes. The other last thing I would say is just the importance of sharing and leveraging relationships. So it's, all well and good for us to be a place where folks may come to us for policy related questions, but to also connect people directly to the folks who are impacted by the issue as well. So not being a gatekeeper, but using the role that we have to make sure that folks are able to, decision makers are able to talk to providers, that our coalition partners who may not have a Springfield lobbyist, that they're also able to access those decision makers as well.
Thank you so much. That was so incredibly helpful. I feel like people are going to really take a lot from what you just said. And thank you also for mentioning the connection to attacks on gender affirming care, because I feel like it's something people don't necessarily talk about enough. And if there's anything I've seen in my work tracking the attacks on abortion rights, it is the very, very clear connection and how those issues are completely inextricable. So to Kelly, I just want to focus on some of that data and research that Khadine mentioned as just one component of proactive policy campaigns. Guttmacher, such an incredible organization, conducts original research, and of course, science and evidence is really a cornerstone of your work. Can you give some recent examples of how that works in practice?
Absolutely, thank you. Yeah, I think Khadine really set me up well to kind of talk about some recent examples, and she referenced the monthly abortion provision study, which is something that I think very much came out of what you mentioned, Jessica, too, which is that the post-Dobbs policy landscape was really defined by chaos and confusion. We saw legal decisions and attorneys general decisions about a state's trigger law and new policies and new bills really being introduced or decided on in what felt like a near daily basis, right from the June 24th, 2022 Dobbs decision up through today, right? And so the result of that is that chaos and confusion around a state's legal status of abortion means that patients and providers are kind of stuck in limbo. And of course, it is patients who really suffer the most. And so having some evidence in the last couple of months coming from our monthly abortion provision study to really paint a clearer picture about what abortion care is looking like on the ground really helps us, I think, cut through some of that chaos and confusion in service of trying to make sure people can get the abortion care that they need. So this monthly abortion provision study really does aim to do that, to estimate state-by-state numbers of abortion provision within the formal healthcare system while we are in this landscape where 14 states have totally banned abortion and many others are implementing other kinds of abortion bans and, of course, other abortion restrictions as well. Some of what our data showed is that what we probably expected, which is that the proportion of patients who were traveling across state lines to get abortion care somewhere else in a state where it remains legal doubled, with nearly 1 in 5 patients doing that in that first half of 2023. Now, traveling across state lines for abortion care has always existed. We talked earlier, or Jonathan mentioned that, Roe v. Wade was really never enough to ensure access to care. And there are other reasons, of course, people would go to another state. But to see that big increase, that kind of doubling of patients, I think really tells several stories. One of which is that the world of abortion funds and practical support organizations have just done an incredible job trying to match patient need and get folks where they need to go. So they deserve a huge amount of credit. And, I think National Network of Abortion Funds just put out a report too, though, about how their post-Dobbs giving really spiked up, but it has since dropped down. And so I think it's really important to note that that is not necessarily a sustainable solution to what should be good public policy, right? We should not be ceding public policy to volunteer organizations and abortion funds. So I think both those things are true at the same time. And another thing I want to highlight came when we looked at the July numbers of abortions. So July of last year, that is when North Carolina's 12-week abortion ban went into effect. You might recall last summer, there was a lot of back and forth in North Carolina about the particulars of the abortion ban that was going to go forward. It was vetoed by the governor, and then the state legislature overrode the veto. And there was a lot of talk about an abortion ban at 12 weeks being a so-called compromise. Now, we know that any abortion ban is a bad abortion ban, and we're not here to compromise away our rights and our freedom and our justice. And to see in July, once that 12-week abortion ban went into effect, that the numbers of abortions in the state dropped about 31%. But what was really important, I think, about that data came from our conversations with partners and providers on the ground in North Carolina, which is that there were other components of that law that may have actually contributed to that reduction in abortion care just as much as, or perhaps even more than, the new gestational ban. And that was the introduction at that point, or the implementation of an in-person requirement for somebody who was getting an abortion and needed some state mandated counseling a set number of hours prior to that abortion care. And so having the data to say, wow, we have to remember that it is not just abortion bans, of course, that are making abortion care difficult to access, or for some people impossible to access, but it is the host of other kinds of abortion restrictions that we've been fighting for decades, right? We know that they have been what our opponents have been pushing for really ever since Roe. And so I think for us, that really tells, this data really was able to remind us all that we are, not just here to fight against abortion bans. That is not enough. Any abortion ban is a bad abortion ban, and we really need to be talking about true access, which is where states like Illinois and other places come in, where we say legality alone is not enough. There is still work to be done. Nobody can rest on their laurels and just say abortion's legal here and that's enough. We've got to keep finding what the data is telling us about where patients are going, who's not getting to care that they might have otherwise wanted, and what are the policy solutions to try to solve that gap.
Thank you so much. I don't think that anyone could ever accuse you of resting on your laurels. You all are doing really, really incredible work. I just want to go back to Kimberly for a second. You talked a little bit about the importance of democracy and seeing abortion rights as a democracy issue as well, and URGE is a reproductive justice organization that also has this focus on democracy. What does that look like in practice? And how do the young activists who are part of your base, part of the organization's base, see the connections between issues of democracy and abortion rights?
Absolutely. So I want to start by just sharing just my love and appreciation for how young people are showing up in this political moment. I think we have finally buried the myth that young people don't vote. We have had record youth voter turnout in the last 4 cycles. And I want to be really clear about why young people are voting as well, because it's not always, I think, for how they're portrayed. So when we think about how are young people under attack, particularly in places like the South and the Midwest, where URGE does much of our work, we have attacks on democracy, attacks on trans young people, attacks on abortion. There's more, but just to hold those 3, because there's literally hundreds of bills in state legislatures focused on those 3 things. It's all about self-determination. These are not separate issues. And to paraphrase Audre Lorde, young people do not live single issue lives. Young people are not single issue voters. And so I'm so glad that Jessica and Khadine particularly raised the issue of gender affirming care, but it's even so much more than that. The question of whether trans young people can exist, can go to school, can be safe, can live with dignity, all of that is under attack, frankly, by legislators who have nothing to offer their constituents and are using trans young people to distract from that deep deficiency on their own part. So when we think about, how are young people approaching elections? Young people do not have some fantasy that they are going to vote and then everything is going to be fine. Like, that is over. Young people see the failure of our institutions, the inadequacy of what is truly an aspirational democracy, not a full democracy that it should be. Young people are voting anyway. They see states making it hard for young people to vote, targeting Black and Indigenous, disabled, and rural voters, and they are voting anyway. URGE chapters in Alabama, Ohio, Georgia, and Kansas have said this time and again. The polling that we've done of young people across the country all confirms young people are informed, engaged, intersectional, pissed off, and they are voting anyway. And so I'm really proud as a reproductive justice organization of the work that we've been doing to engage voters. And I truly believe that reproductive justice organizations like URGE are uniquely positioned to do voter engagement. We are working year round with communities. We don't just show up before the election, make a bunch of promises, and then disappear, right? We are building community 365. We understand what our people care about. We are multi-issue. We know that humans are multi-issue, right? And so we can talk to people in issues in ways that speak to their broad values and to the hopes that they have for the future. And reproductive justice groups are collaborative. We are growing strong movement ecosystems in cities and towns and states all over this country. When I think about 2024, yes, there's this big election. It's also the 30-year anniversary of the reproductive justice movement. And when I think about our founding by the incredible Black women leaders who brought us this movement, embedded in that founding was the idea that we get to create the future in which we can live and thrive. That is what reproductive justice is about. And I think that message is going to be so resonant with young people and with all sorts of folks as we look throughout 2024.
Thank you so much for that. It's incredible to me that the stereotype of young people not caring about politics or not being engaged could still be around, because that's what they said when I was a young person, and it wasn't true then and it isn't true now. And so I'm so grateful for the work that you're doing and all the young people that you work with are doing. It's totally, totally incredible to watch. One of the things that we do a lot of at Abortion Every Day is call attention to stories that don't necessarily get the attention that they deserve. And in part, that's because of this crisis in the media industry and the way that local media really has been dismantled, which means there can oftentimes be a real lack of sunshine on state and local lawmaking. We will often uncover things like Republicans pushing abortion bans that also lay the groundwork to ban birth control, or legislation that would also criminalize someone causing their miscarriage. And that is the kind of extremism that doesn't always get caught or doesn't always get reported. Khadine, you spend a lot of time in Springfield in the Illinois State House. How important is transparency in governing to your agenda for abortion rights and other issues? And how can people who care about this issue help improve that transparency?
Yeah, Springfield, my home away from home. So I think it's important to hold legislators accountable. What do they stand for? Do their actions and votes reflect those actions? I think that is key in terms of increasing transparency. And in terms of what can people do, the first thing is engage, calling, visiting your legislator, showing up to events, taking action. Right now, as folks are preparing for a primary election, there's lots of coffee hours and Zoom opportunities to engage with legislators. Take advantage of those things. I think those are really critical, because then legislators see that they're being observed, that they get a sense of what issues you care about, and you're willing, especially if you show up in person, if that's something that's possible for you, or if you're able to show up on a Zoom opportunity, it makes them understand that people want them to take action, but they're also there's a mechanism to hold them accountable. We hear from legislators all the time that if they get sometimes more than 10 calls on an issue, they know that it's important. If they get letters that are not form letters, they know that it's important. And I know sometimes we get overwhelmed, or it's like, do I have to fill out another action alert? Oh, this email has come to me. Should I take action? Does it really matter? It does matter. And I think that's a really critical thing to do. I also think giving people feedback and support when they do well. We often take our champions for granted. Like, yes, this person is a strong, hardcore supporter, but sometimes we don't realize the backlash that they're getting from the other side. So I think part of holding folks accountable is that when they do the thing that we want them to do, and they really push for the protections that we're seeking, to let them know that we see and we appreciate it. The other thing I think that folks can do in terms of transparency is to connect our support for abortion to our support for other issues that are related. So, for example, one of the things that we saw post-Dobbs and in the policies from hostile states is an attempt to surveil folks who are going from their state to another state. And that's a really great opportunity to connect the issue of abortion rights and access to the issue of privacy, health data privacy. Who has access to your information? What are they doing with that information? Limiting the use of surveillance devices. I mean, automatic license plate readers, which are able to track, like, oh, I'm going from Ohio, coming into Illinois, I'm going to this facility. Oh, that facility provides abortion, and then I'm going home. So thinking about those issues is and making that connection. So for ourselves, if we care about abortion rights, what are the other things we need to care about? And then how are we pushing our policymakers to care about those things as well, especially when that's not traditionally been their areas of interest. Let them know, like, if you care about abortion rights, you have to care about these things as well. And the same passion that we have for protecting choice, access, that's the same kind of energy we need to bring to those intersectional issues as well. And I guess the final thing would be to, I don't know if there are funders on the call, donors on the call, but funding and supporting organizations that do on-the-ground organizing. That is so key. It's key in states where there are ballot initiatives. It's also key in states like Illinois, where we have protections in place, but we want to keep them. And we want to also push back on any attempts at the state or local level to undermine that protection. So those are some of the things that come to mind.
Thank you. Kimberly, same question. How does transparency factor into your work, and how can people help to improve that transparency?
Absolutely. So first, I just want to plus 1 million what Khadine said about appreciating our champions, particularly in places like Ohio, Alabama, Georgia, these legislatures that are so hostile to so many of the issues that our communities care about. What's coming up for me is just how incredibly persistent young people are, because not only are these legislatures often making themselves opaque to the press and the public, but they're even hard to access. I think about, URGE chapters and team members who have, really shown up, knocked on the doors, figured out, when are these legislators going to be in their offices so that they could have the conversations that they needed to have. I'm struck too by the incredible bravery and resilience of young people, including young Black and Brown, young trans and gender expansive folks who frankly may not literally feel safe in their own person entering some of these legislatures. I think about particularly some of the work that our trans and gender expansive folks have done in Alabama, literally testifying on bills that are negating their very humanity, that are negating their very dignity, and doing so just with such courage and such moral clarity. So really, I just want to applaud the ways that young people are overcoming the obstacles that a lot of these legislators are trying to put up. They're not letting the evil deeds happen in secret, and they're bringing them to light. Of course, I just have to give a huge shout out to local journalism. It is so important. Often local journalists are the only ones covering, on the ground organizing work. They're often the ones who are covering the incredible work that folks are doing in states and towns that otherwise do not get the attention that it deserves. And then the last piece that I want to name that, again, I think young people are showing and leading the way is young folks aren't necessarily waiting for a journalist to cover the things they care about. Young people are creating their own news. They're creating their own content. I think about some of the folks that URGE has worked with in our Folks program and our Self-Managed Abortion Festival, literally working with young content creators who are writing zines, creating art, creating video content to teach one another about issues like self-managed abortion, contraception, the issues and concerns that they feel are most important. I think about, also some creative ways that we can hold legislators accountable. There was a legislative session where, we knew that the Georgia legislature was going to be messing with young trans people, messing with abortion access again. And so we actually welcomed them with a huge billboards and visibility all around the state that said abortion bans are racist. Because part of what we want to do is just tell the truth. We can talk about why abortion bans are bad for a lot of different reasons, but I think we haven't said enough what's plainly true, which is that abortion bans are racist and that they are an attack on Black and Brown communities. And so those are some of the accountability measures that URGE's young folks have been using with legislators, and I think they're having an impact.
Amazing. Thank you. And especially thank you for talking about one, telling the truth. It's so important. We do not focus on, we are telling the truth, and let's be real. And also talking about the importance of local journalists. I would not be able to do the work that I do without local journalists completely informing everything that we're doing. So it's so important that we're showing that support wherever we can. I think we have time for one more question for each panelist, and then we're going to take some audience questions. So if you have questions, make sure to put them in. Kelly, I'll start with you, and then we can go to Khadine and then Kimberly. We are at the start of a monumental election year for many, many things, including and especially abortion rights. What are you preparing for, and what do you think we can expect? We'll start with you, Kelly.
Sure, thank you. And I will preface by saying Guttmacher Institute is a 501c3 nonprofit organization. We don't do electoral work. And of course, the elections are the sea we are swimming in, and the context that is obviously unavoidable when you're talking about this or really any issue. And add to that 2 Supreme Court cases on abortion that will be heard this term. One around mifepristone, which, as you know, is the first medication in our standard protocol, or standard protocol for medication abortion, and the other on a really critical question that I kind of can't believe has to be asked around whether hospitals have to provide life-saving care to a pregnant person in an emergency where an abortion might be, what they need to save their life. And so we will continue to have this topic be one of the major topics of conversation this year and beyond. And I think when you add to that again, this year already, we're only in January, but there are already over 1,800 sexual and reproductive health and rights provisions that have been introduced at the state level. So we know that, again, the state story will continue to be a primary component as well. And we are seeing that the 14 states that have banned abortion, they're not necessarily stopping there. I think the big topic that they are exploring, and I think that we all are really paying attention to, is this question of whether or not, or how a state could restrict travel for somebody in their state to leave and get an abortion elsewhere where abortion remains legal. And again, it feels like an outrageous question, but we know that our opponents are incredibly extreme, and so really no idea is too outrageous for their consideration, unfortunately. We have one law that was enacted last year in Idaho that really started with young people, right? We've talked a lot about young people, and we know that they are often the first audience that legislators kind of try to see how far they can go legally when it comes to restricting their abortion rights. And so Idaho enacted a law that really would stop folks from helping a young person leave the state to get an abortion where it is legal. That's not currently in effect, but we have already this year seen 2 copycat bills, one in Oklahoma and one in Tennessee, and I think we'll continue to see more as the kind of constitutional questions around that continue to be raised. You've probably also seen in Texas, localities have been thinking about and acting on ways that they think they can also try to restrict travel within their localities, whether it's on county roads or other things like that. Again, these all seem incredibly outrageous and almost unrealistic that it's possible, but it is evidence that Dobbs was not the end, and the Dobbs decision was not their end goal. They are trying to stop abortion anywhere and for anyone and for any reason. So I think that will, of course, just really be the major topic of conversation, and the continued connections that we've talked a lot about here already between how their extremism in their attempt to ban abortion totally really means that they're also trying to restrict democracy in many ways. We heard about this from Kimberly around ballot measures. We're seeing in other areas, state legislatures are some of the primary, seats where democracy is supposed to happen, and yet many people are, gerrymandered into districts that don't really represent their values, and as a result, we get policies that don't really represent the will of the people. And we know that's incredibly true with abortion, where poll after poll shows that 65, 70, 75% of people want to see abortion remain legal, and yet here we are.
So some of the things we're looking at is keeping an eye on what's happening at the local and state level. So what are the bad bills that are being introduced to roll back the protections we have for reproductive health and access, and also gender affirming care. We're also looking at work that's what's happening at the local level as well. We've seen instances where localities have tried to push sanctuary ordinances for the unborn. And we've been really heartened by the work and the organizing that's happened at the local level. So continuing to push back at those attempts at the local level as well. Implementation is also very important. Again, it doesn't matter if you have a law in the books if it's not working the way that's intended. So continuing to monitor what else is needed, what other protections do we need to have in place, what are we seeing from the data about who's coming to Illinois and what their needs are, and connected to that, not just thinking about it from a policy, legislation perspective, but also as it relates to funding. It's really important that there is the funding to provide that care and funding for the folks on the front line as abortion providers and the different kinds of funding that they may need. And it's also important for the folks who help to facilitate folks who are seeking abortion to getting the care that they need in Illinois. I know that there are some places where folks, I think there was a question in the comment about the idea of, maybe donors feeling like, why do we have to foot the bill for the folks who are coming in for other states? And I just think about it as if Illinois wasn't in the position that we're in, we'd want someone to be able to help support our folks who are having to travel long distances in order to access the care that they need. So that is the benefit and the responsibility of being a state that is able to provide care in a way that's safe for folks who are seeking both reproductive and gender affirming care. And I guess the last thing around that is to continue to do education with our policymakers, and education about things like the importance of reproductive and gender affirming care. We can't have one without the other. And that needs to be the mantra that we continue to push forward. So those are some of the things we're looking at.
All right. So if you're here and you've been listening to us talk about abortion and democracy for 51 minutes, it's because you care. And so if you care, what I'm going to need you to do is stay hydrated, make sure you're resting, get your comfy pants on, take some deep breaths, because it's going to be a long year. So what do we have to do this year? Y'all, I'm not even going to read you the list, but there's like almost a dozen states that might have abortion on the ballot all over the country. We got work to do. We are preparing for an election that could possibly result in the further rise of authoritarianism and white supremacy in this country. We have to be preparing for that. We also have an election that could result in the possibility of a bunch of people getting elected because they promised to restore access and legal abortion. And if that happens, we got a lot of accountability work to do in 2025 to make sure that those folks keep the promises that they will be making all year long. We have to vote, not because it's perfect, not because it's going to fix everything, but it's part of how we build power. And we have to keep fighting before and beyond the election for the liberated future that young people are dreaming and that our communities deserve.
Thank you all so much. Everyone is so smart. It's so nice to listen to you all. We are going to go to questions. And the first audience question is for Kimberly and Khadine. Kimberly, since you're here, maybe you just want to stay on. It appears that while ballot initiatives succeed, the very same voters who made that happen don't then vote for pro-choice candidates down ballot. Those anti-abortion candidates then win and turn their attention to immediately trying to undermine the past initiative. What are we missing?
So a big part of what we're missing is the gerrymandering that is happening in our state. So when we think about, why do our state legislators look the way they do? Yes, some of this is voter behavior, but some of this is also the deck is stacked against us. So we need to be doing redistricting. We need to be looking at these voting maps. We need to be engaging in, the litigation that raises the civil rights issues. So I think there's a whole universe of things that's about getting these maps to actually represent the people. And then the other piece is culture shift. We have got to be having more conversations, not just with people who agree with us, not just with our buddies, but with people that maybe we're not that, you can't imagine getting anything in common with. Because when we do that for a ballot, we can convince people that voting to support abortion access is a good thing. I think if we had different conversations with a broader base of folks, we would see voter behavior look different because people could be opened up to a whole variety of issues that they care about and that are connected to how they vote.
Plus one to what you said, Kimberly. I think another aspect of it is helping people to understand the connections of why that particular office has an impact on the issue that they care about. You know, right now we have a state's attorney races happening. Most people don't understand the intersection of that state's attorney race and what that could mean for access to reproductive care or abortion care. And I think part of the work is that level of education. So it's not this theoretical thing. It's like the AG's office is important for this reason. The school board office is important for this reason. And here's how they've impacted access to information. Here's how they are, harming our LGBT youth. So I think that level of education is good as well.
Excellent, thank you. The other question we have is, what role do faith communities play and can play in this activism? And anyone who wants to pick that up should feel welcome.
Okay, well, I'm very excited, so I'll go first. Faith communities are so important, particularly in the states that we work in the South and the Midwest. Progressive faith leaders are such important voices. When I think about, the work that we have done with legislators, a lot of these legislators need to hear from faith leaders in order to make different decisions. Voters also need to hear from faith leaders. I'm thinking about the work that we did in Ohio, some of the ads that we ran with Black faith leaders, right? Basically saying to people, you can be a person of faith and support abortion access. A lot of times folks need to hear that in order to give them the moral space to do what they believe is right, which is to protect abortion access, but they need that reassurance from a faith leader. So faith leaders have been part of so many of these victories. They deserve, much appreciation. And I think particularly in the parts of the country where we work, they're such an important part of the work.
And I would add too that we know our data shows people of all faiths use contraception and have abortions, right? I think for too long we've sort of politically seeded this idea that our opponents of abortion kind of own the moral high ground or the religious or faith-based position, and they don't, and we know that to be true. And so I think speaking to our values at all levels really provides a way in for people to think about this issue a little bit differently. And it's just incredibly important to make sure, as Kimberly said, that faith-based communities are core and part of your organizing, because we need everybody. Oh, Jessica, I think you're muted still.
Of course I am. Sorry. I just wanted to make sure that Khadine didn't have anything to add before we moved on. Okay. I think we have time for one more question. And this one says, thank you to all of the panelists. I am interested in hearing more from Khadine and Kimberly about how new and emerging research and data on travel for abortion care, abortion provision, etc., has either helped them directly make the case for expanded protections or better understand how they can direct resources to assist those particularly hit hard by bans and restrictions.
Go ahead, Kimberly.
Sure. One thing that comes to mind that's been really meaningful, data that shows how people are getting abortion care post-Dobbs, who is traveling, is also telling the story of who is not traveling and who is not continuing their pregnancy, because that tells us who is self. And so the sort of missing piece of the data that we're still needing to put together, but it's coming clearer, is that there are a lot of people, and they're disproportionately young and poor and Black, who are not able to leave their state, but cannot remain pregnant. And so the data is incredibly important to tell the story of something that's really been happening, behind the scenes, right? It hasn't been happening in a way that's really visible, but we need to know because people deserve information about self-managed abortion. That is a human right, no matter where you live.
Yeah, we've also seen with the data that as the number increases in terms of people coming to Illinois, what does that mean for how long folks have to wait in order to be able to have an appointment, to be able to schedule their appointment, if they're ending up going to a higher number of weeks is that more time spent away from home, the cost to the provider, the cost potentially to the person. I think some of those are really helpful. It also helps to think about what kind of funding needs to be in place in terms of, is it more staff people? Is it more beds? Is it like the specific kinds of support can also help policymakers figure out what are the grant opportunities or the funding opportunities. Is it capital? Is it something else? Like, what does that mean for providers who do, abortion funds? What does that particular funding looks like? And then, as we've seen, a lot of states who have bad laws in place, like the bounty hunter kinds of laws, does funding and support also look like legal help and legal support? Does it impact insurance? So that's some of the stuff that's been really rich. And then when you tell, policymakers, we need more money, and they're like, well, do you really need more money? How do you know? Then now we have these monthly numbers that come up. And the other thing I appreciate about the Guttmacher spaces is that it also offers the space for us to talk or know what the numbers look like from other states, and then be able to have a conversation with those folks in those other states to think through, like, why did the number go up and down? Like, what are again, thinking about not just policy as in laws, but also like policy as in practice. What are the things that we can do to help support the folks on the ground here and their folks who are coming to Illinois and the providers who are providing the care here as well?
Well, on behalf of the Guttmacher Institute, I just want to say thank you to everybody who joined. We have such amazing questions in the queue that we didn't have time to get to, but thank you for them. They're so thoughtful. And of course, this amazing set of panelists and Jessica Valenti as our moderator has been incredible. We've talked about the urgency of this year and how the fight is not over. We are launching with this, our Data for Democracy fundraising campaign to make sure we can all keep doing the work that we need to do. I hope you will consider supporting URGE, ACLU of Illinois. If you are not signed up for abortion every day, of course you should be immediately, and the Guttmacher Institute. And you can see in the chat that some links are there. So we just say thank you so much, and that we are all in this together, and we can keep on going. Jessica, I'll turn it to you.
I just wanted to say thank you to everyone, and I wanted to acknowledge, for the panelists and also for anyone who's on the call. I know this work is so hard and so challenging and so exhausting, and it's not a 9 to 5, it's a 24/7 gig. And I really want to acknowledge how difficult this has been for all of us. I really know that. But I also know for me, and I imagine for a lot of you all, that this is the most important work that we'll do in our lives. And so I really try to carry that with me and carry the knowledge that the American public really is with us, right? Like the numbers on our side, voters are on our side, and we're working on behalf of the majority. And so despite everything, I really do feel optimistic, and coming into spaces like this make me feel so hopeful and so energized. And I really hope the same is true for all of you. So thank you to everyone for joining. And I hope we get a chance to do this again.